Hey everyone, it's Dr. Andrew Orr here. Hey, I wanted to come on and do a quick video chat about a very important topic that I wanted to put up. It's to do with people's pelvic pain and also the cramps and abdominal pains and stuff that they get, that they often believe are things like endometriosis or adenomyosis or some other gynecological issues that they have. Now, often when people come to see me, they come to see me for things like endometriosis, adenomyosis, PCOS, and other issues to do with women's health. And often because they have a diagnosed condition, they often will talk about all the symptoms that they are getting as being that. Like if they've got endometriosis, they'll say, oh, my endometriosis is flaring and causing all this stuff every day. Now, while some of that might be true, and while things like endometriosis, adenomyosis are inflammatory conditions and they will inflame certain parts of the pelvis and cause referral pain and all kinds of stuff, what I actually see is that a lot of people actually get a lot of other conditions missed along the way. One of the things I do see is things like adenomyosis and endometriosis often get missed and dismissed, as I always say. Often things like endo and adeno get diagnosed as being like IBS and all kinds of stuff. So it's very crucial when you're going through someone's health history that when you're looking at things like endometriosis, to go over things like interstitial cystitis, make sure they don't have adenomyosis, and also go through pelvic floor issues as pelvic floor pain as well, and musculoskeletal issues that could be causing their symptoms as well. And this often isn't done because it all gets labeled under like endometriosis. And we see that a lot of women that have endometriosis also have adenomyosis, and it's been dismissed. But sometimes it's my job to go through and actually find all this and find what's been missed and dismissed. And that often leads to the diagnosis of women not only have endometriosis, they have adenomyosis, they have interstitial cystitis, and they have pelvic floor dysfunction. So, or what we call pelvic floor hypertonus, and where the muscles in the pelvic floor are really tight. So that brings me to my next point, because I get a lot of people coming in and then they're saying, like I just said to you before, oh, my endometriosis has flared this week. Oh, I've been laid up. The pain's unbearable. And what we end up often finding is that that person might have a full bowel. And we have to explain to them, because it's about asking questions, right? Okay, is it just endometriosis? And a lot of the time when we send them for scans and things like that, we end up finding out that their bowel's blocked up. Now, some people say to me, but, but I'm going every day, right? But what a lot of women also tell me is that they often feel like they're not emptying the bowel enough. And they don't feel like they're fully, voiding and getting rid of stuff. The same goes for the bladder as well. Often they'll say, I feel like I've, gone and emptied my bladder, but I still feel like it's, there's more there, and I've still got this discomfort. And that's often the case. And so what ends up happening when they're not having a complete bowel motion, over a period of time, the bowel starts backing back. And we start getting this sort of impacted bowel where it starts compacting, right? And then the bowel swells and things like that. And then they've got this full bowel, and they're associating that with the endometriosis causing all the issues. Now, endometriosis could be flaring the bowel as well. Don't get me wrong, it can be on the bowel, and there can be adhesions which are constricting the bowel, which is then making it harder for the bowel to move. Don't get me wrong, that does happen. But it's important to go through things properly, because a lot of the time it actually isn't the endometriosis, it's a secondary issue that's causing their problems. So everything gets put on endometriosis or adenomyosis. The same as sometimes we see with, like I just talked about, the bladder. The bladder itself can often be flared or inflamed, and it can give all the same symptoms as endometriosis or adenomyosis. We often see these symptoms where a woman will wake up and say, I woke up with, oh, I've had the worst endo flare this morning. I woke up with it. And that often is a trigger for me. One, you woke up with it. So what normally happens when you wake up in the morning? You usually got a full bladder, right? Some people's bowel is full in the morning too. That's why a lot of people have to get up and go in the morning. But it gives you an idea, because then the bladder's full, okay? And if it's inflamed, and also, look, we do have bladder endometriosis, which is rare, but we also know that a lot of women with endometriosis and adenomyosis also have interstitial cystitis that's never been diagnosed. I can never understand why, when a woman has had a laparoscopy, why a cystoscopy isn't done at the same time. It's a 30-second procedure to put a camera inside the bladder and have a look. It is no extra, it's not hard to do, but it's often overlooked. So a lot of women with endometriosis and adenomyosis and PCOS and all that often also have interstitial cystitis. But the other thing is what we see, and I've talked about this before, and I'll bring this up for you to have a look, is the pelvic floor and stuff as well. I'll get a picture of the pelvic floor and then we'll have a look and I'll show you what I mean. And it's always the way when you're trying to bring up something. And there we go. Oh, it is starting to, there we go. Oh God, technology. All right, so you can see here where the pelvic floor is, right? So the pelvic floor is very, very close. It helps support the bladder. It also supports the vaginal area as well, and then it goes around, and also it has a function with the bowel. Now, this is where we talk about pelvic floor hypertonus and pelvic floor spasm. I'll bring up another one because it might show it a little bit better. Return there and we'll have a look at this one because it's a little bit better and it shows you just that little bit more. So as you can see where the pelvic floor muscles are here, and hopefully you can see my cursor here, you can see how the pelvic floor muscles come up the side of the vagina, each side of the vagina there, right? So this is where we often get women that get vaginal pain, like they get pain on intercourse, right? It's because they've got pelvic floor hypertonus. The pelvic floor is that tight, which is constricting all the vaginal tissue and firing the nerves off at the same time. So it's completely inflamed and it's just firing off all the time. So as soon as that they have penetrative sex, it's going to hurt, right? And again, a lot of the time they blame it on endometriosis, and it's not, it's actually pelvic floor hypertonus. And one of the things I often ask women is, can you put a tampon in? And they go, oh God, no. Oh, no. Why can't you? Oh, I can't get it in. It's painful. And I'm like, is it really tight to get? Oh yeah, it's so tight there. And you're like, yeah, that's pelvic floor hypertonus. What's that? And I've talked about that in other posts, so you can go and have a look. But that's what's happening. It's not the endometriosis at all. So, I mean, the endometriosis could be flaring the pelvic floor off, don't get me wrong. But a lot of the time it's this pelvic floor hypertonus that's never been dealt with. And I'll tell you the answer to that in a minute. And then you can see the pelvic floor muscles also go up the side of the rectum there and then up into the colon, the bowel and stuff like that. But it also supports, the pelvic floor also supports the bladder, right? So if the pelvic floor tightens and contracts through there again, and we get that pelvic floor hypertonus, it's going to constrict the bladder. So you can't fully, it's like constricting a hose, right? It's not going to allow a lot of that urine to come out. Sure, you'll be able to avoid a bit, but often it can be hard for them to go, geez, I find it hard to move my bladder. Sometimes I've got to sit there and really think about it so I can move the bladder, because it's about relaxing the pelvic floor and then they can go. So, but sometimes what happens is that some of that urine is staying there and then they're getting what they think is a UTI, and it's not really a UTI at all. It's a UTI, like, because we go and we get them to do a P test and we find out that there's no infection there, no bacteria and stuff like that. But we have a look in there and there's a heap of urine still retained in there. So this is where the issue is. So again, and then again, as I was talking about the rectum, if the bowel gets constricted and they can't pass a motion properly, it can be painful on bowel movement too, because all the pelvic floor is firing off again, and there's all those nerve endings and causing pain. And it causes constriction, so they can't properly void and remove, the stool doesn't come out properly. So then it starts backing back and compacting, and then the next minute we have a look and we do a scan and they've got a full bowel. And this is where all the referral pain and all that comes from. And sometimes we can have the bowel clogged up. We have the pelvic floor constricting the vaginal area and that firing off, the pelvic floor firing off there. And then that sends, as you see before, and we'll just quickly have a look at that again, you can see also where the pelvic floor muscles, it goes up the side around near the coccyx too. So we see these women say, oh, I've got this bad pain in my back, it feels like in my coccyx. Oh, I've had this coccyx injury. I must have, I've fallen on it or something when I was younger, or it's not that at all. It's all the pelvic floor firing off. And it's also then creating referral pain into the sacroiliac joint. And then that sends pain up the spine, and then that sends pain up through the abdominal cavity and so forth. And that's what's happening. It's all this referral pain, all stemming from a very, very tight pelvic floor that's firing off and creating all those pain and pain pathways. And this is what it is. So often what we perceive as the endometriosis causing all that inflammation is actually the pelvic floor. So this is where, like, a colleague of mine actually does some nerve blocks into the pelvic floor and some Botox into the pelvic floor, and it settles the pelvic floor down and creates, for some women, it can give up to an 80% relief and reduction in their pain. And there's not a lot of people that do it around Australia, and which I'm really, really surprised. So it's a great thing, but we also about, helping women settle some of that pelvic floor spasm down. So that's where we can talk, get women to be referred to pelvic floor physios, and there's special exercises and dilators, and we even look at things like some of the eggs and that now, because again, just remember this whole area, right? It's a muscle, and it's about if this was your arm or your leg or whatever, and you had pain, what would you do? You'd massage it, right? Well, how do you massage that? Well, it's quite hard. So that's where pelvic physio can get in and actually physically start, and it can, believe me, it'll be painful. But that's where things like these can actually help, because it's actually like doing that. And it's also dilating and stuff at the same time. Anyway, these are all the things I go over with women and my colleagues and stuff like that, and why women with gynaecological issues need a multimodality approach, because there's not just one thing that's going to help it, and it's not about just taking a pill each time. And this is what we see too, because what happens then, if you start taking narcotics, well, one, you can become addicted to it. Two, a lot of pain medications, what are they going to do? Well, they're going to cause constipation, aren't they? So they're going to slow down your bowel movements, and then you're going to clog your bowel up more. And then, they cause referral headaches and, as you withdraw from them and all kinds of stuff. But it clogs the bowel up more. Guess what? You've already got a full bowel. And that's where it's this constant vicious cycle. And it takes the right person to sit there and go, okay, what's going on? Is it just endometriosis? Do I listen to the person telling me it's all endometriosis, which is often what happens? So they turn up, oh, it's my endometriosis. Oh, we'll just take these painkillers and off you go. Problem with that, as I said, it creates all these other issues. And also there's interstitial cystitis there and stuff like that. If they're eating high acidic diet, not an alkaline diet, and then they're, eating badly, because that's the other thing too. Some people are eating quite badly, and they're eating all these pro-inflammatory foods, which is then firing all this off as well. So firing off through here, all the pelvic floor, the bladder, the whole thing, the bowel's clogging up more. And this is why you have to look at diet, lifestyle, and looking at mindfulness technique because it's about relaxing, right? If you don't relax and you're constantly like this, everything's tightening up more. And then you're sitting there on the pelvic floor and everything's tightening up more. And then you're going and exercising and tightening it up more. Now, it's not saying don't do all that, because you need to do exercise and you need to do all these things to keep you well. But sometimes it's hindering stuff, and that's why you've got to work backwards and go, how are we going to relieve this and that and that, and what is actually firing off here? And a lot of times it's that. So I wanted to come on and talk about this because it's a very important topic. I see this a lot. Probably 95% of my women with endometriosis and adeno think that it's all endometriosis, adeno, and or PCOS and all that causing all their symptoms, when really it's not. It's their bowel, it's their bladder, it's pelvic floor. Okay, I just wanted to bring that up, and hope that helps you soon. Helps you as well. And as I say to people, if you do need help with adeno, endo, PCOS, or women's health issues, fertility, call my friendly staff and they'll be able to tell you how I might be able to assist you. And again, I've also got people on our experts program that are also may be able to assist you as well. All right, talk to you soon.